doing this, Carrie already teased this a little bit, but about a year ago, Becca, who you see on the screen, reached out. I am also an LCSW, and finding supervision across the state is really hard. And I have always believed that our rape crisis programs are a great place for folks in the social work and other behavioral health spaces to grow in their profession. We have opportunities for people who have a BSW. For those who pursue masters and licensure, there are opportunities to grow in those clinical roles. That's the process that I went through, and I really want to support people who are doing that. And we know it's hard to find a supervisor. It's hard to keep clinicians on staff. It's expensive to pay for it independently. And so I appreciate that Becca brought this challenge to us, and it was an opportunity for our organization to try to think creatively and do some problem solving. At the same time that she was raising that challenge, our state changed the supervision law to allow it to be remote, that historically it needed to be face-to-face. It does still need to be live, but it can now be live in a remote capacity. And so that opened up the opportunity for us to try to find someone who could do supervision across the state. And so through a lot of research, fortunately, I had gone through this process myself, but in a different state. And so we started with NASW. We reached out to their leadership to try to say, here's the idea we have, but we want to do it right. Help us. And so NASW worked with us a little bit and then connected us with a former staff member at the licensing board. And he has been very helpful in making sure that our program design is going to work. At the end of the day, we want to be clear that if you are an LSW who is working towards the independent licensure, it's important that you research and understand the process, and that is kind of squarely on the plate of the candidate. But we also want to set people up for success and build a program that is designed with an understanding of what the requirements are and supporting people who are intentionally trained in supporting survivors of trauma, and in our case, survivors of sexual violence. Because our state will be better if we have better trauma-informed clinicians wherever you go. My hope is that you'll stay at your rape crisis center and climb that ladder, but wherever you go, our state will be better if we have equipped therapists. So through that process, we found Sarah, and essentially the design is that Indiana requires 4 hours of live supervision per month for a licensure applicant. It would likely be remote considering where you all live, but that would really be between you and Sarah to figure out. But ICESA has applied for grant funding to put the bill, essentially, to pay for the cost of the supervision sessions so that you can do a combination of individual and group sessions. And I will let Sarah introduce herself and talk about exactly how she's going to organize the program. But that is our goal, is that we want to remove the financial burden of people seeking supervision. We want to make sure that supervision is happening with a supervisor who is approaching it in a thoughtful and planful way to develop clinicians, so that you can support people in their professional development, retain people on your staff. Hopefully we get to a place where it's something you can offer when you're recruiting candidates. But for now, we are building this plane while we fly it. So I will stop talking and I will turn it over to Sarah so that she can introduce herself and talk about the program.
Awesome. Thank you so much, Kelly. Can you guys hear me okay? I have a little bit of a quieter voice, so sometimes I have to shout at people, and so just let me know if you can't hear me. My name is Sarah. I'm an LCSW trained by the IU School of Social Work. Again, I'm going to trip over my words because I'm so grateful to ICESA and for you guys, for being here. This is kind of an incredible, Michael alluded to it briefly, but this is kind of an incredible opportunity. It's really hard to, as somebody seeking LCSW licensure, to find appropriate supervision, and to have an organization that is committed to solving this problem to, for the betterment of our clinicians across the state, is kind of amazing. So I'm really excited to be here. Like I said, I went to school at the IU School of Social Work with a very intentional focus in not only trauma-informed care and crisis intervention, but specifically to work with survivors of sexual violence. That's an issue that's extremely important to me. That's why I got into social work. I believe very strongly that the more noise and light we bring to this issue, and the more we can support our clinicians and those who are working in the spaces of supporting these families, the better off we're all going to be. Silence only empowers the perpetrators. So the louder we are, and the more educated we are, and the better supported we are, the better we're all going to be across the state. It's a really important issue to me. So I did my internships throughout school at Riley Hospital for Children, and then I subsequently worked in the emergency room there, and then switched over to inpatient for my last few years there. And throughout that process, obviously in the emergency room, you're working in crisis and trauma the whole time. But I also had the privilege of supporting pediatric survivors of sexual assault and their families throughout that, and was able to present at several different SANE nurse conferences and about the role of social work and how important social workers are in that space, both in the hospital setting and beyond, because we know it doesn't stop at the hospital. There's forensic interviews, there's testimonies, there's counseling, there's support that happens after that. So I kind of left the hospital space after COVID. I stuck it out through COVID, and then was kind of needing to take care of myself, because that was a hard place to be in during that time. So I'm now in a more remote role, overseeing medical crises for of all things, a travel insurance company. So when people are sick or injured and they're on their vacation, I help manage those crises for them. So I've really been looking for a way to get back into a space that allows me to work in the realm that I'm passionate about, which is this. So I was very, very excited when this opportunity was presented to me. And I'm so excited to be able to support you guys and your teams in their quest for licensure, because the more letters we have behind our name, the more seriously we're taken sometimes. And that's silly, but it just is what it is, right? In terms of how the program is set up, Michael and Kelly both kind of alluded to this. It's fluid, right? We're figuring this out. We have a contract that we've developed in conjunction with NASW to make sure that it works for both me as a supervisor and the supervisees. It's a draft right now. We've put everything we can into it, but if, I was looking at it today, and I feel like I've looked at this document so much that I'm probably missing things. So if there's things that need to be added or changed, let's have a conversation about it. I'd love that. I'm a very flexible person, so I want to make this work. I want this program to be a model for other organizations to follow. That's really important to me, that we start a trend. I want this to be a trend so badly, because this is so needed. So in terms of how we're setting this up, like Kelly and Michael said, once the supervisee comes, presents himself and is like, I'm interested in this, I want to do this. Indiana standard, at least for LCSW, states that they need 4 hours per month of face-to-face time, and now that can be virtual, which is awesome. There is the opportunity for those who are not social work specific. LCSWs can supervise, oh my gosh, my brain just lost itself. Licensed mental health counselors, wow. Brain just lost. So there is an opportunity for those people who maybe didn't get a social work degree but have a mental health degree and are pursuing their licensure, the LMHC licensure as well. So that is an opportunity that's available. I am not well versed on the LMHC requirements. I believe they also need, I know they also need supervision. The specifics are not as familiar to me, so that'll kind of be on the LMHC. If that is something that they want to pursue, we can have a more intentional conversation about that too. So, but I will go ahead. I'll share my screen just so you guys can get a look at the contract. Once you guys kind of identify some supervisee candidates or they express that they're interested, scheduling and all of that will just kind of be between me and the supervisee and what works with their schedule and what works with mine, with the intention of having 4 face-to-face sessions spread out a month. So let me share my screen really quick or figure out how to do that. Kelly, I may rely on you though.
That's okay. I have it pulled up, so I'm happy to share for you.
Okay, because my computer is yelling at me about pop-up windows.
That's okay.
Thank you so much.
Did everyone see that?
Yes.
Okay. Sarah, you just let me know. Oh, sorry, Michael.
Can you zoom in on it a little bit? Maybe make it fill the screen. Thank you.
Yep, you just let me know when you are ready for me to scroll down, Sarah.
I will. So like I said, I am more familiar with the LCSW licensure requirements. This is what Google told me about the LMHC, the second paragraph there. If that is incorrect, please somebody correct me. But I believe LMHCs need 3,000 hours post-degree, which is pretty standard. And then 100 of those hours have to be face-to-face with a supervisor. So however that maths out is what we will do. You can go ahead and scroll, Kelly. I won't read this to you, but basically supervision is defined as a safe space, first of all, for you guys to talk about your role, right? Your case specific issues, ethical dilemmas, and receive kind of a guidance, support, education, and feedback on some of the things that you are experiencing, some of the things that you're doing, interventions, whether they are mental health interventions or, like mental health specific for diagnosis specific stuff, or other trauma intervention, trauma-informed care and intervention stuff, whatever that may be, just feedback on that, guidance, education, and support, most importantly. Confidentiality is obviously extremely important to all of us. It should be maintained at all times. I don't need to know the specific names of your clients unless obviously something becomes a mandated reporter situation. Someone is in danger, hurting themselves, others, and that will be a conversation with you, me, and your supervisor, and we can just kind of figure it out from there. But you can feel free to change names. I certainly do not want to be another party and intruding on anything that needs to be confidential. Supervision termination. My goal is to get you to licensure. There's nothing else to say. My goal is to get you to licensure. But if the program is defunded for any reason, or if something happens and you change positions, or X, Y, and Z, my job then becomes to make sure that all of the documentation on my end is complete, as complete as possible, so that you have it in your hands, so that you can take it to the next supervisor and be like, okay, this is what I did with this one, and here's how many hours I have left. So all of that will be kind of in a pretty little package for you to take with you. I've outlined, you can go ahead and scroll, Kelly. I've outlined supervisor responsibilities and supervisee responsibilities below. We've kind of noodled a lot with both of those, but I think we've got them pretty well pared down. Obviously, informed consent is extremely important, as is upholding the ethical guidelines of both the NASW and the American Mental Health Counselors Association. I'm happy to send out those ethical guidelines to anybody who needs them. They're kind of my living, breathing document that I work with daily. They the other thing in here is, so it's my responsibility to uphold the ethical guidelines and professional standards, but I also have that obviously in the supervisee responsibilities as well. We discussed this briefly, but accurate and clear supervision records, collaboration. My job primarily will be to provide just a really solid place for the supervisee to feel that they can bring both personal ethical dilemmas, like, hey, I'm really struggling with this, but I don't know why I'm struggling with it kind of questions. And hey, I don't like the way this is being handled at A, B, and C level, like legislature, all down to the organization level, and I don't know what to do. And, you know, those kind of conversations, all the way to, hey, my client is doing this and I don't feel good about this. So let's work through it. Obviously, professionalism is extremely important as on both sides as well. Kelly, you can scroll. And then supervisee is there as well. So it's basically the same thing. We're maintaining documentation. We are coming to a supervision prepared to discuss things that are relevant and happening with our client cases, and identifying those ethical dilemmas, open to constructive feedback. I promise I'm a nice person. I'm not gonna be super harsh. There's definitely things that I have picked up in my time at the hospital, my time, I had my own mental health practice for a while, realized that wasn't kind of where my heart was, so moved out of that. But you know, just things that I've picked up and I've learned along the way, things that you've picked up and learned along the way, and just being prepared to come and share those things that, you know, we're all better when we're working together. So and then obviously, like, maintaining the schedule, letting us know ahead of time if something comes up. You guys are extremely busy people, and so if something comes up, let's just talk about it and work with it and reschedule. It's not a big deal. And then I do want to point out in here the language that this program is funded in part by the grant that they wrote, and then that's the contract. So there it is. I'm not sure what else to say about it. We'll send it out, I think, so that you guys can look over it and read over it and talk with your staff and your people about it. But I'm happy to answer any questions about the process that you guys have. I know I'm tripping over my words and stumbling around, but I'd love to answer some more intentional questions that you guys may have that I haven't answered.
Thank you so much, Sarah. And another thing that I'll say, I mean, ICESA has obviously contracted with Sarah to pay her. And in that, we've asked that she maintain liability insurance. And we've had a lot of discussion about how the candidates are employees of your organization and will continue to have site supervisors who do,
yes,
you know, staff reviews and make hiring and firing decisions and all of that stuff that has always gone along with your being their employer. There is just an additional support person to really focus on that clinical development piece.
Yeah. So not supervising in the sense of, you know, your hours at work or anything like that. Just specific your clinical supervision, getting you to that licensure place.
If I could ask a question, so if I have a candidate right now that we're considering hiring, and this person will need supervision,
Yeah.
is this something then that we have to get approval for? Do we apply for you to do that, or what's the process if we decide this is something that he might want to do?
Well, that's a good question. I would say probably the agencies that have someone identified that they want to refer should reach out to ICESA, and then we will bring Sarah into the conversation. We have to get a sense of how much interest there is, how much capacity we're going to have. Sorry, Michael, I didn't realize you go.
No, keep going. I was just going to say that, yeah, I think that, you know, this isn't necessarily a process that's open to everyone in the state. We definitely want to focus on rape crisis centers and sexual assault service providers first. And Sarah is also only one person. So, if we suddenly have
Yeah.
15 people that are interested, we'll need to figure out how that looks and see if we need to bring on someone else or whatever. We also only have so many dollars to put toward this. And in the current structure that it is, and if there really is that interest and the need is out there, Kelly and I can try to go after more money. We can't promise that, and it might take some more time to develop that. But I think in this situation, yeah, the referrals should flow through us first, right? Like, and we can get them in contact with Sarah and make that connection. We just kind of want to be aware, and Sarah can kind of keep us informed as well from that standpoint. But otherwise, we'll kind of see how that goes. There's no official like rule right now that you have to like send in an application or anything like that. We just want to make sure that the person is, employed, or somehow significantly connected to a service provider, to make sure that those dollars are staying within the programming. If that helps answer your question. I think that was Amy's question.
Yes. So as a domestic violence shelter, then I'm assuming we wouldn't necessarily be the primary organization that you would be looking at, but there's possibility we could use this service.
Maybe. I mean, Kelly, I don't know. Amy, do you guys do dual at all, or do you also have sexual assault folks?
We have sexual assault, but we're not a sexual assault center, no.
Sure. I would say you would
Okay.
be in the same priority, right? Like, I mean, well, I don't know that we have a line right now, but if there is, we would probably have to codify something that, rape crisis centers would probably get first. Doing sexual assault work 24/7, would probably get first priority. After that, sexual assault service providers, kind of in the same way that I don't want to invoke ICGI in this discussion at all, although they are our state administrator for this money. So, but in the same way that, those dollars kind of flow there, we would probably consider the same kind of priority. Should we have, and let's absolutely have victims of our own success, right? Like that this program is so popular and so well received that we have to figure out how to sort folks, but that would probably be the order. So yeah, that's a
Okay,
good
thank
question.
you.
What other questions do you guys have for Sarah or for Michael and I? Sarah, do you have questions for some of the folks who have expressed interest in the program?
Yeah, I think Becca may be the only one on here who has done any level of supervision before. Is that, well, other than the ones who are already licensed, but what kind of has worked for you in the past, and what do you feel like was not at all helpful? What should we be making sure we incorporate or not incorporate in this from your perspective?
I mean, I think our general guidelines have pretty much been cohesive with the contract that you've already formed. So some of that case discussion, talking about billing, coding, what that all could look like, talking about different therapeutic techniques, some of those sort of like ethical challenges or dilemmas that may come up. That's pretty much what I've been doing so far. We might start with talking about cases, and then as other things get brought up, then we might go into therapeutic techniques. Like my last supervision session, we just started talking about psychodynamic, all of that kind of stuff. So
Yeah.
I kind of like the flexibility of that. I am more interested, I think, in like actually having that conversation of scheduling, figuring out what all those pieces are going to look like with both of our schedules.
Yeah,
That kind of stuff.
for sure.
Yeah.
Sure. Thank you. I don't think I have any other questions, but I definitely, as you guys have said, it's new and fluid, and we want to make it as successful as possible. So I think feedback as we go through the process is going to be super important to all of us, to making sure that this is as helpful as it possibly can be for you guys, so that we can repeat success and start a trend. Let's start a trend, please.
I hope so. I hope so. Other questions from the programs? I know it's a lot to digest, so it's okay if you need to think on it for a while and email us.
And I don't know if this has been said enough, but I am not then going back and reporting to your supervisors at work under any circumstance unless something is harming you or a client, or there's a danger aspect involved. That's my role, is to support you as the clinician, not to get you in trouble at work or anything like that. That would be a breach of confidentiality. So
Yeah, I think we wrote that into our contract with Sarah as either risk of harm or a substantial ethical concern that couldn't be addressed through the supervision process, where she, if you're doing something that's completely unsafe and outrageous and unethical, then yes, we would want her to address that. But also, I hope that's not happening. I trust that's not happening.
And any conversation like that, if that has to happen, will happen between you and me and the supervisor first, or me and the supervisee first, before anything surprises you. So
yeah. Carrie, did you have, sorry to put you on the spot, but did you have a question for Sarah?
Just how soon could we get started? Like, how soon will this be available?
Yesterday? No. That's a question for Sarah, but the funds are accessible. I think I'm okay in saying this. Michael can tell me if I'm wrong. We are ready to roll. So if you are interested, if Becca is interested, email me today.
Okay.
Yep, I'm ready.
And then I think there was somebody on here from the human resources standpoint. It would be okay to let our human resources folks know that this is a possibility. I mean, how we word it is based on availability of funding, so that it doesn't feel like a guarantee through the hiring process, but you feel pretty content that we can kind of update our HR specific staff to say, hey, be looking for candidates that might need licensure, because while there's no guarantee, there might be some funds available to take a position within our agency that could provide that supervision level.
Yeah, Carrie, I think that's a really good question. I think availability of funding and availability of spaces in the program.
Okay.
I think those two would be our biggest key right now. And again, if we start to hear from you all that you have people and we don't have space, we'll absolutely start to go figure out how we deal with that, right? But I think for right now, I believe we wrote into Sarah's contract something like 5 folks for an individual, and then I don't remember how many for like potentially for group work. And who knows, once Sarah starts, she might realize 5 is not enough, right? Or not enough, right? But like, oh, I could do 1 more, or I could do 2 more, and we could, or something like that. But we want to kind of ease into it and see how many in a virtual environment can one person supervise, and Sarah's going to have to be the barometer there. Otherwise, I don't, like I said before, I don't want to necessarily be like, oh yeah, we have 15 people, Sarah, here you go, and you have to figure out how to do this because we contracted
Sarah
with you. Yeah.
Pump the brakes real
Here are
fast.
the other supervisors that need work.
Yeah. And to be honest, I mean, there's only so many. We do have funding for 2 years. Now it's more like a year and a half because we're getting started a little bit later in the process, but it's funded through VOCA. So it's the VOCA funding schedule. So this will last through September 2026. After that, we'll have to see what all the stuff is happening. We would love to continue to be able to fund something like this, whether through VOCA or one of our other programs that ICESA already gets granted, or a third-party private. Once we are able to establish that this is something someone needs, I feel like it's very easy to take this as a package to somewhere and say, please fund this, right, from behind. And we have some support from NASW as well, wanting to do the same thing. So whether it's us that does it or NASW or some other person, like we're happy to start it. We don't need the accolades. If if someone else wants to take it and run with the model, all we care about is getting clinicians in the field. So I think that's our focus. But good question, Carrie. That's a long answer to a question, but I think if we say, if you all want to, by all means, market it as availability of funding and spaces in the program, if that helps you get butts in the seats, by all means.
Carrie, the other thing I would add is Michael and I mean, we're super accessible. So if you get to the final hiring phase with someone, and this is, because if I was your candidate, that would be make or break for me. So if you get to that point with someone, call us and say, is this slot available or not? So that we can tell you that in advance, because, between us, since that's just one quick phone call to Sarah to say, do you feel like you have capacity for another person or not? And we can tell you that ahead, because I wouldn't want to put you in a position where you hire someone and then they leave you after 3 months because it wasn't the deal they thought. But we could maybe give you a sense of, well, Becca's going to be finished in about 2 months, and so maybe there would be capacity at that time. Just let us know if you need feedback on that capacity. Other questions? Sarah, we won't send you 15 people tomorrow, I promise. I saw just a little bit of
terror.
Did he just say 15? I didn't sign up for 15.
No, I would be so excited. I wouldn't be able to physically do it, but I'd be so excited.
Any other questions from folks? Okay, well, I think what we do from here is we'll give Michael and Sarah one more chance to look over the draft, and then if you are interested, or you're a staff member who is interested, email me. I will talk with our team. We'll look at what the capacity is and send the contract once it's stamped in ink for you as the supervisor to read, for the applicant to read, make sure there are no concerns. And then once people are signed up, that the scheduling of it all will be a combination of what capacity do they have in their normal schedule. So I would ask that you as the supervisor be thoughtful that if you are sending, if Becca signs up and she's going to have appointments at whatever time on Thursdays, do try to prioritize that time for her. I'm just picking on Becca because she's the one that started this ball down the hill. And so we'll leave it between the candidate and Sarah to set it up and have the sessions, and Sarah will document, and then she will invoice ICESA for that time. So we'll be on the back end in terms of paying her and keeping that contract, but the actual logistics of the sessions and the documentation, and that'll be between the supervisor and the candidate. And hopefully no concerns arise, but if there are questions or concerns as things go, we're here and we're happy to help and keep the wheels on this bus. But I think it's exciting, and I hope that people want to engage, and we'll see. Anything you want to add, Michael, Sarah?
No, I think just adding clarity that ICESA is really only involved in the money part. So we, will absolutely, like Kelly said, help if something happens, or if for some reason Sarah's trying to work with a location and they're not being helpful in some way, like, of course, we'll get involved should we need to. But otherwise, this is the Sarah and, candidate show. So, she won't come back and report to us. She'll need to report to us what's in her contract and, and those kind of things. But the details and all of that, that's all confidential. I quite frankly don't want to know. So I don't want to be responsible for any of that information. And I don't think our organization wants to. So we'll sit back, do the administrative part, and hopefully keep the money flowing so that this is something that can be an opportunity for everyone going forward and help keep that pipeline of clinicians in Indiana as flowing as possible, right, under the circumstances. So.
Last thoughts, questions?
Just a huge thank you again for
Well,
making this happen.
It was fun. It was a fun, I mean, it wasn't fun when Becca asked me and I told her no. That part was really unfun. But I think that it motivated us to try to figure out how could this happen. And thanks to you, Becca, for advocating for yourself and for your program and for your own professional development. Because I want this opportunity to be available to people across the state. And long term, if we equip folks to do this, then you may someday have in-house supervision. But in the meantime, we have to build capacity across the state. And I also think it does give really interesting opportunities for people to do some group sessions and hear about what's happening in different parts of our state, because it's really different between, the Safe Place service area and the Prevail service area and the Center for Women and Family. And so hearing what are some of the trends in your community and how can we do a great job of building this network? I'm excited, and I hope it's super successful and that people replicate it. So thanks for going on this little ride with us. Okay, I will wrap it up unless, Sarah, did you have something to add?
No, it was just really nice to meet you guys, and I'm looking forward to working with everybody.
Those of you that want to raise your hand, send me an email. The sooner the better. And I would say we're at Wednesday. So in the next week, we want a sense of how many people want to do this, so that we can get people started, because the money is available. So let's use it. All right. Well, have a great day, everybody. Email us if you have questions.
Thanks, Kelly.
Thank
Thank
you
you.
guys.
Bye.